My name is Crystal Miller. I am the STLP coordinator at Heartland Elementary, and today we are visiting Hard Memorial and getting to see the technology in the medical field. This is so important with career paths and getting ready for students to start thinking about that with the great opportunities in Hardin County Schools with EC3 and just determining what classes that they need to take in the future. Today we've got to see some robots, we've got to see technology with the ambulance system and the flight nurse flight helicopter system. So it's been a great experience for the students to be able to see that and how things work and how video games and cell phones will really connect to that whenever they get ready to choose their career path.
Welcome to HMH. This is our global headquarters. Do you know what that means? Global. Do you know what the word global means? What's it mean, Kevin? Absolutely. This is the only HMH, the only Hardin Memorial Health in the whole wide world, and you are here. So we have a fun day, we hope, in store for you today. But you know what? This is a busy hospital, and it is a working hospital. When do you think we're open? What do you think our hours are? Ava?
24 hours.
24 hours a day. How many days a week, Caleb?
7 days.
7 days a week. How many days a year, Vivi? Every day, right? We never, ever shut down. What about when there's a big snowstorm or a big ice storm? Do we close then?
No.
Absolutely not. There are always people who are sick who need care, right? So just remember that you are in a working hospital, and so we've got a good schedule planned for you today, but it could change at any moment if something changes, okay? So my name is Tracy Trout, and I've been here at Hardin Memorial Health about 5 years, and I am not a nurse, I am not a doctor, I don't do anything that has to do with patients, but the work that my team does helps the people who take care of patients, right? So one of the things we work on marketing the hospital, letting you know that if you're sick, you can come here and we'll take good care of you. We work on raising money for the hospital so that we have extra things that we need to help take care of you. And we do a lot of other things too. So it's a really amazing place to work. We're going to ask you some questions about HMH and see what you know. We're going to take you several different places and let you see how we use technology to take better care of patients. And I know that's what you guys are all interested and into, your technology leaders at your schools, and that's why we thought it would be great for you to come and see some of the things that we do here. And what we're going to show you is just a tiny, tiny little piece of some of the things that we do. But we're going to go down to our emergency room, or our emergency department. Has anybody been to the HMH emergency department? Raise your hand if you have. Okay. What do you think we do there? What are some of the things you think we do, or some of the kinds of conditions we take care of?
Like the ones who are really sick.
Okay, people who are really sick. What's this?
A car crash.
Could be, right? What else?
An emergency.
An emergency, right? That's why we call it the emergency department. Now here's your first quiz question of the day. So how busy so there are 124 hospitals in Kentucky, okay? 124 across the state of Kentucky. All right, where do you think we rank, and you can't answer this, where do you think we rank in terms of busy? So of all the emergency departments at all the hospitals in Kentucky, how busy do you think the emergency department is at Hardin Memorial Health? Fourth? You're really close. Harper?
I'm not Harper.
Oh, I'm sorry. Taylor, sorry.
Third.
One more guess. Ava?
Fifth.
No. Caleb?
Sixth.
No. Other way.
Second.
Second. Think about that, you guys. 124 hospitals, and we are the second busiest. So it is really, really, really busy down there. We take care of a lot of people. Sometimes 200, 250 people a day come through our emergency department. So we're going to go do that and show you how we use technology to try to take better care of people. And then we're going to come back up and get changed. You have to put on some special clothes, and we'll tell you about that in a minute. You don't have to take your clothes off, you just have to put on something over your clothes. And we're going to go down and see our operating suites and what we call our Da Vinci robot, and how doctors use this technology to do special things with patients that help them, as our banner says, smaller incisions or openings, less pain, and faster recovery. They're back to work or back to school faster. And then we'll come back up here, we'll have a little lunch, hang out for a little while, and then you get to see our radiology department. Now, what do you think that is? Does anybody know what radiology is? X-ray, right. And all the machines that our physicians and providers use, we won't get to see all of them, but we'll get to see some of them that they use so they can see inside you to see what's going on, right? So they're going to show you some of the things that they do. And hopefully that'll give you a quick snapshot of some of the ways that we use technology. So who knows if they were born at HMH? Does anybody know? Oh my, look at all this. Oh my goodness. And I asked who'd been in the emergency department. Who has been a patient here? Has anybody been an inpatient here? Yeah, a couple of you? Okay. All right, good deal. How many counties do you think we serve? And we're here in Elizabethtown, so we know Hardin County, right? Because that's where we live. How many other counties do you think we draw patients from? What would you guess? How far do you think people are? Lex, what do you think?
3 other counties.
Okay. Who else has a guess? 4. Keep going. What do you think? 5? No. Keep going, Eleanor. Oh, geez. Yeah. 10. And yes, in full disclosure, this is my daughter who knows the few of the marketing pitches. 10 counties. That's right, 10 counties. How many people do you think that might be? Take a guess. Whole lot more. What, Caleb? Not quite that many. Somewhere in between. Somewhere in between. What do you think? A little more, 400,000. So that's a tenth of Kentucky's population. Did you guys realize HMH was that big? I sure didn't when I started working here. I had no idea we were that big or that busy, right? And okay, here's one more bit of trivia for you. Number of babies that are delivered here in a year. Lots and lots of kids are born at HMH. And I will tell you this, that we are is it 8th or 9th now? 9th busiest delivering hospital in Kentucky. So remember those 124 hospitals? We're number 9. So that means there's quite a few babies. Not a million, Caleb, not a million. How many do you think?
400.
400 more.
600.
More. Ava?
1,000.
More. What do you think?
100,000.
Not quite that many. Last year was about 1,500, 1,600, something like that. So lots and lots of babies. Think about how many that is a month. It's a lot of babies. So it's a busy, busy place and a wonderful thing to have in our community. So it's one of the reasons we're so glad you're here to see it. So,
all right, so has anybody had their blood drawn before? So get your blood drawn. It's going in these tubes. There are several different analyzers. We'll cover this one. So this is our analyzer. Once it gets put on, the first thing it does is spin it. So it takes the whole blood and spins it down into this. This is all done by the analyzer. Then it's going to take it and it's going to separate the plasma off what we need to run the test. And it's going to relabel it for us. And then you all don't have to follow me all the way, but it'll go down to the actual chemistry analyzers, and that's where it's going to take a very small sample of each of this and run several different tests. We have a chemistry analyzer, we have a hematology analyzer, and urine analyzers. Same thing, all we have to do is get your all's blood drawn. It goes straight onto the analyzer, so that's capable of spinning it down, aliquoting it off, and running the test. So that's pretty cool that this machine can do all of that, huh? That one does the same thing with urinalysis. Danielle, if you want to just hold up a urine specimen, it takes it and it analyzes it for chemistries, and then it actually looks at it and looks for those cells and those red blood cells and that bacteria that could be in your urine causing problems. Okay?
This section is called microbiology, and in this section, this is where we get different kinds of specimens. So if they wanted to take a look at maybe drainage that's coming from your nose, or if you cough and you're coughing something up, that's going to come over here. It might even be a specimen, like if they have you use the restroom, that would come to this area, and they take a look at it. Remember we talked about strep throat, where they'd swab your throat? This comes in this area, and remember we talked about the dishes. Miss, is it Kate? Katie. Yeah, Katie is going to tell us a little bit about that, okay? Or show us.
Right here. This could be something called E. coli. It's not the kind that makes you sick that you hear in the news all the time, but this one is from a urine sample.
this is what it looks like.
They use the restroom, they went in a cup, if you've ever had to do that, and then it comes here and they swab it onto this area.
Yep, so all these little circles, that's little colonies of bacteria growing on this plate. So you don't want to touch it. It's okay that it's near me, but you don't want to touch it without gloves on. So, and then here's one of the other plates that we use. So depending on what kind of bacteria it is, you know, we can kind of sort out using different plates. You know, if it grows on here, then it's this. If it doesn't grow on here, then maybe it's this. And then we can run it on our other machines, and it kind of tells us what medications to use for the patient.
And Katie, sometimes it could be a bacteria or it could be something called a virus. Have you
Yes.
heard those two words? So if you have a virus, you don't necessarily take a medication like an antibiotic. They ask you to get better maybe by rest or eating, you know, different foods and taking care of yourself in a different way. A bacteria, you usually get an antibiotic, and that's why they do all these tests.
How do they, why are they different colors?
Well, they're just different plates. So some bacteria on here will turn purple, and some of them won't, and that's kind of one of the things that we use to kind of rule out. It's kind of like detective work back here a little bit to figure out what's what. So
How do you keep track of the different kinds of bacteria that you see? Or who do you tell, what you find?
we went to school and we studied all of this, and then we kind of keep current, and we kind of take classes on our own and stay up to date because there's always new bacteria, you know, being discovered or evolving. So that's how we do that, and then we put it in the computer, and then the doctor can see it, and then they can see how to treat their patient. If you want to see, this one came from a stool culture, which a stool is number 2. So there's always lots and lots of stuff on these ones because there's a lot of stuff that's normal in there, but then there's a lot of stuff that could make you really sick. So, and that's one of the gross parts about working back here, but sometimes that's the only way to tell what's making somebody sick, is to take it and grow it out.
What do you this one, Katie, to show how we're. So this is really cool. Remember how we were talking about what type of antibiotic you need to be on?
So each one of these little strips has an antibiotic infused, I guess, kind of in it. And then these different numbers will tell us whether or not that antibiotic will work for that bacteria. So when you see this, so we cover the whole plate in the bacteria, and then we put the strips on there. So if it does not grow around it, that means that we could use that antibiotic to kill that bacteria because it's not growing around that strip. So if it grows, you know, all the way up like that, that means that that bacteria has made itself resistant to that medication so that it won't work on it. So we do this. And there's lots and lots of different ones, but like she said, we can't do this with viruses. It's kind of different. There's not a lot of medications, you know, for those, but for the bacteria, this is what we do.
So that's why when the doctor gives you medication, you need to finish that medication that
Yes,
they give you,
yes.
and you don't ever take anybody else's medication.
Yes.
Because it's very specific for what you have. Does that make sense?
What do you do with the plates after you've seen what medicine you need to use?
They go in these big buckets, these big red buckets, and then they get thrown away in the biohazard.
How come when you put them on, they're more of a circular shape?
The bacteria? Well, that's just how they like to grow. They grow in, we call them colonies. So, well, on this one, here, you see how it's real thick up here. So we take a little, it's like a little plastic loop, and we go like this, and then we turn it, and we're trying to thin it out. But they like to grow in little groups like that. But that's good because then we can actually see it because they're so tiny. If they didn't group together like that, I would not be able to see them on the plate like this. So yeah, it helps in identifying them. I don't know how much you want to take them back here. I can show you the inside of the incubator over here. It's kind of stinky, but we have to, when we plate them, we have to put them in the incubator because they need to be at a certain temperature and they need carbon dioxide to grow. So we put them in this big thing over here, they all grow in here, and it takes about a day for them to grow. So it's kind of warm and smelly in there, but that's where they like to go.
We are in Heartland Memorial Health's pathology lab right now. We're going to take a look at a heart and talk a little bit about being heart healthy. All right. This is a real heart. Everybody know how big your heart should be? About the size of your fist. So look at my fist and look at this heart right here. All right. Now, if this heart was in the person's body, it would be pink. This is real, okay? It would be pink because the blood would be flowing through it, and it also would not have the dissection marks in it. Some of you have dissected before too, right? Okay, so this one obviously has been dissected, so it's had the opportunity so that they could take a look at it. Now, a heart pumps the blood throughout your body, and that's what they're taking a look at too, to see if it's enlarged or bigger than it should be. Do we think that'd be too big for me? Yes. It would be, wouldn't it? What do you think all this white area is around here? Anybody know?
Muscles?
Actually, that's the fat that's going to protect the heart. So it doesn't look like there's a lot of fat. There's some around it, isn't there? But not an overabundance, okay? Not an overabundance. So where's Kevin? You had your heart, your blood pressure checked downstairs, right? And you also had your heart beating. Yeah. This is actually what a heart would look like that would be doing that, right? Okay. This is the back of the heart. Okay. And then we have an aorta. See the top hole there? There you go. Going through. Everybody taking a look at that? So do we think this is an adult heart? Yes. It is. You're right. It is. Pretty interesting, huh?
Mm-hmm. What is the water?
What is the water? So remember that smell that we had? They have to preserve it, so they put chemicals in there to preserve it, and then they seal it up. All right, I'm going to put this heart back. He goes back in the refrigerator. I don't know if it's a he or she, but it goes back in the refrigerator. All right. Pretty cool, guys? You all right on that?
My name is Kim Madrazo, and one thing that I found interesting today is the heart, because it was a little bit bigger than it was normally.
This here is actually what they call like a CT scan. So if somebody comes in with a trauma, we're going to go to a trauma room, or they might need to get, you know how we talked about the radiology department? We take pictures of the outside of our bodies, or we take selfies. This takes a picture of what's going on the inside of the body. So it's real close to the trauma room, and we're going to head over to the trauma room, where if somebody came in an ambulance or had an immediate emergency, that's where they would go.
So every time that we have an ambulance that comes to the hospital, they'll actually come straight through this door. And these first two rooms right here are our critical care or our trauma rooms. So basically any patient that comes in that's very, very sick, that needs some really quick, timely, emergent treatment, they'll put them in this room. And we'll actually have a whole team that'll just come and jump with those patients, and they all help each other, work together, trying to make sure that we can get that patient well. And then as soon as we can get that patient to where they're feeling a little better and they're doing better in their health, then we'll actually start moving them into another room in the department itself. Actually, I have Ashley here with me too. Ashley is our charge nurse in the department today. So we'll kind of walk into the trauma room, kind of show you. Ashley's going to kind of help me. We can show some blood pressures and that kind of stuff. So she'll help kind of put a couple people on some blood pressure. Show where we hook the oxygen up and everything to patients. So we can step on here in here. Well, Ashley's going to get Kevin hooked up on a blood pressure.
You want to have a seat on the side of the bed for me?
And basically this is the same thing. You'll see we'll have a patient come in, and the nurse will come in and talk to them. They'll just make sure how everything's going, what are they here for, and then we'll get their vital signs. And we use the technology in the computer to help get an accurate set of vital signs. Does anyone know what the vital signs means in that sense? All right, so you know, what do you think?
Kind of. Like, it shows if your blood pressure's going down or up.
That's right. Yeah. So, yeah.
Heartbeat.
Your heart rate is definitely there. So they'll look for, their blood pressure. They'll look for their heart rate. Sometimes we'll put patients on what's called an EKG, and they'll put stickers and leads on, and it's actually basically taking an image of the heart and seeing the actual rhythm and the electricity that's going through the heart. And now she's taking a blood pressure. Another thing that we check is you'll check your oxygen level. And so one of the Ashley's going to do, it's a little finger probe that just kind of clamps onto Kevin's finger, and it actually will tell us what percent of oxygen that he has. So Kevin's blood pressure 106/66. So you got really good blood pressure. So without the technology that we have in the hospital setting, we couldn't do these things. Back before we had that, everything was done by hand and by ear. You used to take blood pressure. All Ashley had to do was put that cuff on his arm and hit that start button, and it does everything for us. Prior to that, you had to put a stethoscope in. Everyone knows what the stethoscope is, and then you had to hold it onto the patient's arm, and you blew that cuff up, and you have to actually listen, and you would hear the thump 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 thump. You'd hear the heart rate, and when you started hearing it, and then when you stopped hearing it, depending on how tight that cuff got, would tell us what the blood pressure is. Much easier by pushing this button. And so now you look right here on this top line, that is Kevin's heartbeat. That is the electrical current that is going through his heart to help that heart beat every single day. So obviously Kevin has a very healthy heart. He's a very healthy young man, and so he is what's considered normal sinus rhythm. So that is basically telling us that it's beating exactly on pattern. It is perfect. There's no abnormal beats, or it's not skipping a different step. So basically he just has that good, consistent heartbeat. If we see something that is different, maybe somebody, their heart rate, maybe it only beats every third time, or there's a lengthy pause, or maybe instead of 85 beats per minute, his heart started beating 40 beats per minute. And what that's doing, that heart is pumping oxygen through your body. And so if it's not pumping enough, then that's called bradycardia. And when that goes down to that slow beat, then sometimes that patient doesn't get enough oxygen, so we have to step in and help. And you can give medications to that person to help raise that heart rate. If that heart rate stopped for any reason, that's where you get into those emergent scenarios where you'll start CPR and start trying to help get that heart started back. One of the things that is out in the ambulance bay when we talk and see the ambulance outside, they use, because y'all are really here talking about technology and robotics and other things from that standpoint, there is something called the Lucas 2 or the Lucas 3. And I'm hoping you guys will get to see one of those. And it's basically a robot. It's a robot that goes around the person, and it does CPR on that individual. So instead of taking a nurse or a physician or someone else in the room to do CPR, it allows them to be hands-free, and they can take care of the other things with the patient, such as giving the medications or making sure that they've talked to their family or anything from that standpoint.
So Chris, what are some healthy tips for them to have a healthy heart?
Well, obviously you want to do as much exercise and keep physically active as you can. Eating a healthy diet through your life will always help your heart. Just keeping that active lifestyle will help your heart get that exercise that it needs to stay healthy. We want you all, until you're 100 years old, having that same healthy heart like Kevin has right now.
No smoking.
No smoking. That's a big one.
What about Vocera? That's a cool technology thing you use.
Yeah, and Ashley will have that on. Can I borrow your Vocera real quick? So this device is a new technology.
Yeah, what do you think it is? Any ideas? What do you think?
A finger.
Kind of looks like
It
that.
kind of does. Kind of a little big. I got short fingers and it's still too big. But basically what this is kind of like a radio. It's kind of like a walkie-talkie. So if, for example, I needed to get a hold of someone who is Lynn. Okay, so Lynn Mohammed, Lynn is our unit secretary today. So she's sitting at the desk, and so she's answering all the phones. She's helping she's kind of like the central hub. When anything's getting called in and somebody else needs to know about it, she helps transfer. So let's say she got a phone call and it was for Ashley. She could use this device and get a hold of Ashley, and I could say,
Vocera.
call Lynn Mohammed.
Lynn M.
You see, hands-free, quick.
Yeah, I'm holding it.
They're doing what they need to do.
Hey Lynn, this is Chris. How are you?
Good, how are you?
I'm great. I'm sitting in our trauma room, and we have a bunch of students that are here with us today. We were just showing how Vocera worked, so I wanted to be able to call you and just kind of say hello so they could see how it worked.
Well, hello, what's up?
Do you feel like that Vocera has helped us communicate throughout our department?
Definitely, love it.
So that's kind of cool, because somebody that's all the way on the other side of the department can still be in direct conversation. So if for some reason something happened and I needed help in this room, I can hit this button, I could reach right out to any staff member or a provider, a physician, and they could come right in and respond. So thank you, Lynn, for helping with the demonstration.
You're welcome, thanks.
Have a good day.
You too.
And then that's it. So, and then of course, I was holding it, but if someone called me, I don't even have to touch it. It'll basically say, hey, you're getting a call from Ashley. Do you want to say accept? And if I say yes, then we have that, opens up that radio, and we can talk back and forth in that sense. So the ambulance has paramedics and EMTs. So they're not registered nurses, but they have a lot of the same training. They just learn it in a different way. So in the emergency department, we are trained and we learn how to take care of those emergencies of all different kinds, but it's different from how a paramedic learns how to take care of a patient from the time they pick them up to their house to the time they bring them to the hospital. So we work as a team, basically. They start it, and then we take it, and then when we're done, if the patient needs further treatment, we'll send the patient upstairs, and there's nurses up there that maybe they're trained in bone or they're trained in heart, and they'll take care of those things for the patient. Yeah. All right, it's our trauma lights. So if you had patients that really need it to see, like they had a wound or something you need to see close, you can turn these things on. It puts like a really bright spotlight right down on the patient. Or when you turn the lights off, they're like a big green night light.
Mr. Chris, we're ready to go to the emergency.
All right. We'll walk out here. We'll see an ambulance this part.
I'm Jamie. I'm the director of the ambulance service, and we're going to talk about a couple things on the ambulance. Whenever you call 911 and you have a medical emergency, whether you've fallen or you're having trouble breathing or chest pain, then they send an ambulance to you or your house or wherever you're at. So whenever we get there, we have a stretcher, a monitor that we can look at your heart, and we have a lot of different other things that we use to try to make you feel better or try to make you more safe. Like if you break your arm or your leg, then we take splints and we splint them and to make sure that they don't hurt anymore. We've got a new thing, so stretchers before used to have two people to pick them up and put them in the ambulance. Now, one person can do it all by themselves because of technology, because of things that people's developed and made. It makes our job much easier, much safer, and not only is it safer for us, but it's safer for you as well. So if you'll stand back just a little bit, I'll show you how the stretcher works. So it comes out, and then you just literally push one button, and you push this button, and it pulls right off. I'm going to move it over here, okay? So literally with one finger, I can lower it and raise it up. Whereas before it'd take a couple people, and if you have somebody like my size, it'd take probably three or four people probably. So this is what picks it up. And so what happens is whenever I push this button, it locks in, and it has two green lights, and these arms come up and hold it stable, and then the legs come up and then it slides on this track and is secured and locked into the ambulance. So what this is our cardiac monitor. So if you're having chest pain or you're not feeling well, we take this and we hook it up to you so we can see how the electricity goes through your heart. So that's what makes your heart beat, because all your muscles need electrical impulses to make them contract, and your heart is a large muscle. And then if you're having like a heart attack and things, we can see that, and then we can notify the hospital and let them know that you're having a heart attack and have other doctors and nurses and things ready to take care of you. And we can actually, through Wi-Fi, which all y'all know what Wi-Fi is, I'm sure. That's how you play your games. But Wi-Fi, that's how we transmit. We can actually transmit an EKG to the hospital. So it's like sending a text. So we kind of send a text of what your heart's doing to the hospital so the doctor can read it. And in this thing here, it's called a Lucas 2 device. So if for some reason that you or somebody else or somebody at Walmart or wherever, their heart quits beating, then we can put this on them and it actually does the work of your heart. It works well enough that it gets blood all the way out to your fingertips. And sometimes we're able to get people back whenever their heart stops, and sometimes we don't, regardless of what we do, unfortunately, okay? But I want to show you how it works. This device doesn't get tired of doing CPR, and it does a perfect compression at a perfect rate every time. And it's a piston. Do y'all know what a piston does or is? Yeah? I figured y'all look pretty smart. So you get it out, and this goes underneath their back because you have to have a rigid surface, because if you push on something that's squishy, it's not going to push good, right? And then you get this part out. And this is run by, this is run by a battery. And the battery just pops right out. And you take another battery and slide it in, and you take it and it clips, and it clips, and it's just like playing a video game, okay? So you push the button to turn it on, and it has a little indicator, and you move this down to where it touches the person's chest, and then you literally just push play. Y'all know how to do play? This one little bitty battery will last like 40 minutes. It's really good. And then whenever you want to pause, you just pause. And you hit it again. And it'll do it forever and ever until the battery dies or you're done. So then we'll turn it off. And it comes up. And whenever you want to take it off, you got these two little things. And it just pops right off. Yes?
How much does one of the batteries cost?
About $300. The whole thing is about $14,000. This is $25,000, and this together is about $58,000. And then the ambulance itself, with nothing in it, is about $90,000. Now, one like that is about $150,000. So, unfortunately, things that save your life and things that really help you out is expensive. But you can't really put a value on somebody's life, right? So unfortunately, you know, it is what it is. So, you know, ambulances have a lot of the similar things like an emergency room does. And you'll talk about this, but it's it's kind of this cycle. So it starts with a phone call to 911. We come, and then it goes from us to the ER, and then from the ER upstairs. And sometimes the helicopter is involved within that circle as well. So it's called the chain of survival, okay? So you call 911, we come, and in the ER, and then maybe the helicopter, and maybe the doctors up on the floors and surgeons. So as you can see, it's kind of small in there. So we have limited space to be able to do what we do, but The larger trucks is much easier to be able to move around. We usually use this one to take people to and from like doctor's appointments and things like that. That's why it's much smaller, because we don't really need the extra space. So if you want to get in, just watch your step and just sit on the bench there or look around and walk out the back. It's however you want to do it.
So my name is Amber Stiles, so I'm the flight nurse today. My partner's in the back. I have Mr. Clint, he's our paramedic for the day, and then Mr. Jonathan, that is our chauffeur or pilot, so he's the one that takes us around to everywhere. So this is an air ambulance, so it's an AC-135 helicopter, so you guys can come a little bit closer, we can kind of see it a little bit better. So who knows what we do? Like what do we do for a living? Yeah, okay.
Bring them to the hospital.
For sure. So we're an air ambulance, so we do critical care transport. So that way we take patients from the scenes that are really, they have like traumatic injuries or they're super sick, or we take patients from hospital to hospital. So that's what we do. So that way it's quick, rapid health care. So we do the same thing that the ambulances do, just we're in the air and we're a little bit faster. So we don't have stop signs or stop lights to go through. So how fast do you guys think that we go? How fast? 80. 80?
213 miles per hour.
All right.
I don't know, 100.
Jonathan?
I think it's about 150 miles an hour.
I was close. Pretty close.
150 miles an hour is typical. So it kind of depends on the wind. So you guys are tech kids, so it kind of depends on the wind direction and how fast we can get there. So just career-wise real quick, so I'm a flight nurse, so I've been a nurse for 9 years. So you have to do critical care, which I've been actually in this emergency room for my whole career. I also worked at Jewish, but you need either emergency or ICU to kind of get into this setting. So pilot-wise, I'll let Jonathan talk.
Pilot-wise, they have to be FAA trained, FAA certifications. We have to have so many flight hours, which in flight hours is experience in the aircraft and doing the flight maneuvers, different conditions of flight, things like that. It's all based on certain levels of experience. Like myself, I'm Army trained. I went through the Army, active duty, National Guard, different things. You can do it in the civilian side as well, like go to the airport, get flight lessons, things like that. It costs a lot of money. That's why a lot of people like myself went to the military to get military trained. And then once you reach a minimum of 2,000 flight hours, which is 2,000 hours of set in the air flying these things, then these companies will hire you for jobs like this. And it's the best job in the world, in my opinion.
How many people a day do you take in a helicopter?
We average, throughout the year, we average about one a day, about one a day, maybe two.
About one a day, is that what you said?
About one a day, maybe two on an average, yeah. We'll get around 30 a month. But that's kind of spread out over the course of the year. Like in December, we may have only had 15, or in July, we might have 50. So you just never know.
Usually here to Louisville?
Yes, ma'am. Yep. Sometimes we'll go to Lexington, and sometimes we'll go to Nashville as well, Vanderbilt.
Where do you keep the helicopter?
We keep it right here at Elizabethtown Airport. It sits right there. We're based like 3 miles from here, so really close to home.
Well, I sit here, so this is the nurse's seat, and then my paramedic sits in the other seat. So that way we can kind of both see the patient at the same time. And then our pilot, of course, is up front. Here's the kicker. So who wants to be a flight nurse? No? Who wants to be a flight paramedic? All right, who wants to be the pilot? Oh, we got one. Okay. All right. So who makes the most money? He says nurse, or I say pilot, so I don't know.
It's not about money.
It's not. It's about helping people.
Hi, my name is Maddie Chitwood, and today that was very interesting was seeing the airplane and seeing the ambulance, and that was pretty cool overall coming here.
So my name is Rita Pardee. I'm the Assistant Vice President here at Hard Memorial for Surgical Services. I've been a nurse for 40 years. We won't go into that though. Longer than you all have been alive, much longer, and probably longer than some of your parents have been alive. We'll just leave it at that. So I've been in the operating room most of my nursing career. Love it, absolutely love it. I started out as a scrub technician, and that means I got to assist the surgeon with all the surgeries and get my hands bloody and do all that fun stuff that y'all think is gross. Look at the looks on your faces. And really just fell in love with it. So, and that's as I've grown up in my nursing and healthcare career, I have learned a lot about technology. I've learned a lot about nursing. I've learned a lot about medicine, a lot about people and relationships. And as a leader, a lot of those things are important to understand all that experience and all that knowledge. So one of the things that I do in my responsibility here at Heartland for Surgical Services is I make sure that the surgeons have all the equipment and the tools that they need to do the surgeries that they do. One of the things that you're going to get to see today is what we call our robot. That's a picture of it right there. And it's called Da Vinci. There's different models of Da Vinci. This one that we have particularly is the SI. And we've had this model since about, I guess 2008, 2006, something like that. So what we do with that robot, you'll see here, it has arms on it. And when you'll see this in person when we go down there a lot better, and they're going to set it up and you'll get to play with it and all this kind of stuff. It's got 4 arms on it. Each of those arms holds a different instrument. You'll see the surgeon kind of sitting over in the corner at what we call the console. All that's connected with a big cable. You can't see that in the picture, but you'll be able to see it when we go in the room. On that cable then, the surgeon has little ring fingers that they can sit down, and you'll see it when we go downstairs. And they manipulate these arms and these instruments that are in these arms so that they can operate on the patient. It's almost like having a 3D capability to have their arms and their hands and their heads and everything else inside the patient. Figure out like any of you play video games? Yeah, so when you're playing video games, you know it's almost like you're 3D, like you're inside the screen, right? You set your characters up and you go inside the screen and you do all this stuff. It's very similar to that in terms of how that technology. A little bit more intricate on what they actually do other than playing video games, but it's really a lot of that hand-eye coordination that you guys have to do for having video games. The surgeons have to have that same hand-eye coordination. So one of the things that we do when we go into the operating room is we make sure that that patient has a sterile environment. What does sterile mean? Anybody know what the word sterile means?
Like clean.
Clean. Zero zero microbes in there. That means that everybody's got to have on appropriate clothing. Everybody has to cover their faces. When we have the patient in the room, everybody's got to have a mask on. We have our staff wear surgical scrubs. The reason we do that is we want to make sure that even our clothes that we wear in the operating room is as clean as it can possibly be, so that we don't bring in any kind of microbes into the area where we're taking care of that patient in that sterile environment. So for us today, I didn't change it in my scrubs because I knew I was going to be coming up with you guys, but for today we're going to be wearing bunny suits. I think somebody already said they knew what this was. And then we're going to cover our hair with those paper hats. And then we're going to put shoe covers on our feet, and we have rubber bands for you guys because those bunny suits are a little bit longer, and that way you can kind of put them around your ankles so that way we don't trip. I don't want you to fall when we go downstairs. So that's the purpose of all this garb that we're going to put on. Now I want to caution you because it is a real live OR room. There's not going to be a patient in there when we're going to be in there, but there are surgeries going on in the other room. So Dr. O'Brien is going to meet us down there in about 5 minutes. So by the time we get our garb on and we go downstairs, she'll be down there in the room. Justin Brown is a surgical assistant who's also going to be there helping us and helping with the demonstration, so you can kind of see. You'll actually get to play with it. She'll let you play with it and do it. When we did this before for the juniors and seniors, they had a penny on the table, and you'll see the robot, when you manipulate it, you'll actually be able to pick the penny up, and it looks enormous. You all know how big a penny is. So imagine that under this, like a microscope. You look under, the thing looks enormous when you look at it. So it's going to be really cool. It's going to be a fun demonstration for you. So Miss Tracy, everybody's all garbed up. So what you're going to want to do, we'll go through it step by step. There's a zipper. You're going to want to unzip it. Yep, unzip it and put it on. Legs first are easier to do. If you need to slip your shoe off, you can.
All right, check these out. These are the instruments that we use to actually do the surgery. You can go ahead and pass these around, check them out, play with them. You're not going to hurt them. It'll be fine. Okay? This is our robot. It's made of 3 parts. This is the surgeon console. It's where the surgeon sits. They don't actually touch the patient, which is kind of cool. So you can kind of do surgery through a wire, and the robot will do everything that the surgeon wants it to do. It's kind of like a video game. So they will sit right here in this chair, and their hands go inside these controllers here, and every movement that they make, the robot will copy it. So if she moves to the right, the robot will move to the right. If she closes her fingers, those little graspers will close as well. Yeah? This is our vision tower. That's so I can see what the surgeon sees. Because in here there's a little viewfinder. It's kind of like virtual reality. So we can see what they see when they work. This also has our light source and a bunch of other stuff that's not really important at this level. But, and then over here is the actual robot. All right, here's our arms. They move like this. Here's our camera. And this camera is really cool because it's really 2 cameras in one. So if one eye sees one camera and the other eye sees another camera, then you get what's called a 3D effect. So you have depth. You can see how far away something is from you, which is really cool. If you guys look at the screen real quick, this thing has 10 times magnification, which means that we can see really, really good detail on everything that we're working on. For example, how many of you guys knew that there was a spider on a $1 bill?
What?
100% true.
A spider?
Spider on a $1 bill. I'll show you. Look on the screen. So, you see this over here? How that looks like a spider web? Do you see that right there? All that twisty, twiny thing looks like a spider web. There's the spider.
I never noticed. That's pretty cool. Look at that.
You see it?
Oh my god.
How cool is that? This thing zooms in. This thing zooms in so much that you can see the spider on a $1 bill. Isn't that wild? Yeah. So, also, how many of you guys knew who's on a 1 cent penny? What president? Does anyone know? Abraham Lincoln. How many heads are on a penny? That's incorrect. Try again. 2. Here's 1. We're all familiar with that one. Right? Let's clear that. But guess what? On the back of the penny is the Lincoln Memorial. And if you look close, I don't know if you can see it on this penny. It's kind of rubbed out, isn't it? But Lincoln is actually sitting there in the middle. You see him? Isn't that insane? So when we're doing surgery,
We're showing the detail on a penny and a $1 bill.
when we're doing surgery, we can see extreme detail. Now, what does that mean? Well, that means that if you ever tried to thread the head of a needle, trying to get the needle in the little tiny hole, or if you ever tried to do something like pull a knot out of a shoelace and you're having really trouble with that, this thing allows you to do it like it was huge. Imagine trying to thread a needle, but instead the needle's the size of a rope. I'm sorry, the thread's the size of a rope, and the needle's the size of a basketball hoop. And you're like, wow, that's easy. Well, that's what this does. It allows the surgeon to see things super, super close. And we can also do what's called scaling, which means the surgeon can move their arm a whole foot, but the actual robot will move it just the tiniest amount. So how many of you guys want to see this thing move? All right. Dr. O'Brien is here to show us exactly how this thing moves.
Hi guys, I'm Dr. Brittany O'Brien. I'm a urologist here, and I work with Jay and Stacy frequently with the robot. So I'll go over to kind of my seat as the surgeon where I do the operating. So any movement that I make is going to show here too. So I control the arms, and then that controls this guy, and then Jay kind of helps control this guy too and help us all, and we're just a really good team. So I'll go see what I can do over there, okay?
Can you tell them a little bit about what a urologist does? They've just been to the lab and they've seen some specimens and they were pretty interested.
So a urologist is basically a surgeon of the urinary system. Does anybody know where the urine is made? Where is the urine made? Where? Well, it's so the bladder is like the bowl. It's like the reservoir balloon that holds the urine, but the kidneys, they look like little kidney beans. They kind of sit towards your back. They filter the blood that makes the urine, that drains the urine down into the bladder. So that's part of the urinary system. So as a urinary surgeon, I operate on the kidneys, I operate on the urinary drainage tubes, and I operate on the bladder as well. So that's very, very good. So we do all sorts of different operations here on the kidney, on the bladder, all sorts of different things. Okay, do any of you guys have any specific other questions or things other than about the robot? Yes?
What is like the biggest problem with the urinary?
With the urinary tract? That's a really good question. The biggest problem with the urinary tract is sometimes infection, sometimes it's control of the urinary system. People don't know when they're gonna go, or they can't get the urine out, or sometimes they get the urine out too much and we need to help them control it. There's definitely some cancers that we take care of, so there's all sorts of different problems. All sorts of different problems. All right, I'm gonna go over here and I'll show you guys how it works, okay? And then I'll let you guys look in and see what I'm seeing as well. So do you guys know what 3D is?
Yes.
Yeah. So inside the console, I'm actually able to see in 3D. So exactly how I see you guys is what I can see in the console as well, okay? All right. So basically, I can make adjustments, and then these are my hands right here. So I have my fingers and I have my hands, okay? But I can move the camera, and then I can use the robot to steal the money. My money. Where are we gonna go with the money? I can turn the money over. All right. So if this were a patient, okay.
So did you hear Dr. Bryan? She said if this was a patient, the patient would be laying on a stretcher, correct, Dr. Bryan?
Yeah, they would be on the operating room table. So if they had an area that I needed to sew up with the robot that was teeny tiny, like a little blood vessel. Oh. We can stop that bleeding.
It's way easier than tying your shoes.
So the robot helps me see things that I can't otherwise see. Helps me go places I couldn't otherwise go with my hands. These arms are so much tinier than my hands. So it really helps me access things that I wouldn't otherwise be able to get a hold of. Do you guys want to take a look in? Okay.
Does it burn the skin? No, but it helps burn the inside. What is it? Yeah, we don't want to do it. You're supposed to cut that thing. They were trying to grow up this.
These gel rolls, that's how we position patients. These gel rolls are very, very soft and pliable, and when we put them behind a patient to hold them in a position, it's the safest way. All right, so the things we do with this robot, we take out uterus for cancer, things like that. We take out kidneys. We also take out what's called a partial kidney. So if a patient has a tumor that's on the kidney and it's small enough, we can take the tumor off of the kidney, leave the kidney, and then that leaves the patient with 2 kidneys instead of 1, number 1. And number 2, depending on the type of cancer, it essentially is a curative procedure, which is amazing. I mean, we cure kidney cancer every day. It's awesome. We can take out a bladder using the robot, prostate. We can also do hernia repairs, umbilical hernia repairs, put mesh up in the bottom side of the abdomen, help that. And then we're soon going to start doing colon procedures using the robot. Other institutions do this for hearts, and other institutions may do this for thyroid problems, but we don't do that here. We just do some general surgery, which is the mesh, the hernias, and then the urologic procedures, the kidney, the bladder, prostate, and then we also do a procedure called a pyeloplasty. It's really kind of cool. It's when there's a stricture in the ureter. It prevents urine from dumping from the kidney into the bladder, so it causes the kidney to swell. And if you have that swelling, it hurts. So we'll essentially take the ureter off the kidney, cut out a chunk of that ureter, reattach it to the kidney, and that's it. Good to go. Which is absolutely mind-blowing how we can do that. And the procedure takes an hour and a half, and the patients do great, no more pain, and it's mind-blowing how what was a tremendous problem 10 years ago, 15 years ago, now is like, oh, we're just going to do a pyeloplasty.
Does this make the initial incisions, or is there a surgeon that still?
All right, so we'll start the procedure like any other procedure. The surgeon will stand there with their assistant. I assist on the robot, so I'll be there with the surgeon. We make our incision. You know, we do a timeout. We talk about the patient, their history, what we're doing, why we're here, correct side, correct procedure, antibiotics, and all that stuff. It's very important. And then once we verify that everything is correct, then we go ahead and make an incision. We put in these trocars. I'm not sure if I showed the trocars. So these are the trocars. So everything is done through sometimes 3, most of the time 2 of these. So this is all that's inside the patient. And then the robot grabs onto that, and then all the instruments go inside this. And you'll have a third trocar where the camera goes through, and that's it. We pass all the instrumentation through this. We pass suture through these, all of that.
How much training did it take?
I've been doing this 13 years. I've worked with every robot that's ever been made except for the very newest one, which is called the XI. I'm going to actually, next week, I'm going to go and see it for the first time, and then hopefully this hospital will acquire one. That's pretty cool. But I've worked with the original, which if you looked at this one compared to the original, it's kind of like looking at a 64 Mustang compared to like a 19 Shelby GT kind of, you know what I mean? Like the wires are huge, and there's 800 of them, and now we do everything through a fiber optic cable. It's the size of my pinky. Where the old wires, there were 6 of them, and they're this big around. You know what I mean? So
if they're jittery, I guess that's what I keep thinking. I'm a shaky person.
It accounts for that.
Oh, okay.
You can have as much coffee as you want. You can shake all you want. It's exactly like a camera. Camera stabilization, you can shake the camera and the image stays still. Same thing. If your hand shakes and you have a tremor, the robot hands will account for that and remain still. Okay? And then the thing I was talking about earlier, scaling, it goes in what's called 5 centimeter, 2 centimeter, 1 centimeter. So if I move my hand 5 centimeters, the robot will move 1 centimeter. Or I can make it, I think, 3 to 1, 2 to 1. I think I misspoke. So 3 centimeters to 1 or 2 centimeters to 1. So it's how fine you want your movements to be on how much motion it is. It's kind of like on a computer mouse. If you move it a little bit, the cursor flies across the screen. You can adjust that. It's the same thing here. And then the camera's 3D. I don't know if you guys were able to see that or not. Make sure you take a look. It's absolutely amazing because there's 2 lenses, and because of the offset of space with the lenses, you get a 3D effect. Like you see, I don't know how to describe it unless you actually do it. If you're looking at a camera on a screen, you can try to grab something and whiff because you're not sure about depth. Where with this, you see everything perfectly in 3D. It's absolutely amazing.
Are there extra securities on those, like the actual claws? They're not puncturing. Do they have a?
Oh, there's tons. Okay. For example, if I put an instrument in and the surgeon's working, and the surgeon says, "I'd like to switch from a pair of scissors to a needle driver," I take the scissor out, and when I put the needle driver in, it has memory. It goes to the exact spot where it was, minus 3 millimeters. So for example, if I'm pushing on tissue and I take it out and I put a new one in, it'll go to where it was, minus 3 millimeters, so I won't be pushing on the tissue anymore. And we don't do this, but you could put it in and turn your head and just put it in, and the robot will guide it in on its own and stop it where it's supposed to stop. Now, I don't recommend not watching it, but the robot memorizes where it's supposed to be, which is awesome. That's number 1. Number 2, all of these instruments can only be used 10 times. The robot keeps track. It verifies the cable integrity. I don't know if you were able to look at it, but these actual robots have really small cables, and they're super small. You can see them right here. Look right here, you see these tiny little cables there?
Oh, yeah.
Everything that's done on this robot is run through these cables. So these wheels on the back here rotate, and just moving these wheels moves the cable. Well, you can only process it so many times at a certain temperature before the cable integrity gets a little weak and you can risk snapping it. So manufacturer made 10 uses per. These gold contacts here have a microchip inside, and it just counts. This is a certain serial number. The robot recognizes that serial number and says, okay, this is the third time you've used it. You only have 7 more. And then on your last one, it'll say, sorry, instrument expired, you got to get a new one.
So you have to continually replace the...
We have to, not the cables. We actually, this entire thing gets thrown out at 10 uses, and we just open a new one.
You guys have a special team that does this too. Not everybody that works with the OR is in with the robot.
That's correct. That's correct. We're extremely specialized, and it's important because the surgeon only scrubs in for the insertion of these things, and then they break. They take off their gown and they go sit over there in the corner. So everything from that moment on is the surgeon trusting the team that's sitting at the bedside with the patient to know exactly what they're doing. And that's where we come in. I've been doing this 13 years. Stacey's been doing this about 8. Olivia's been doing this probably 6, 7. So I think the newest...
Especially training.
Oh yeah. There's a whole online course that you have to go through Intuitive, which is the manufacturer of this machine. So you got to go through the whole course. You got to pass the test. Then you got to get hands-on training, and I do the training, and it takes 6 months or so before you're really comfortable doing it. And then at any given moment, there's 100% of the time at least 2 people who know exactly what's going on. So you can have a new person in here and check it out, orient, learn, but you always have 2 people who know exactly what's going on, not including the surgeon. So, yeah, and we keep track of every robot we do. We keep a log over there. I can't show it to you for patient privacy, but we've done 974 procedures here. I've done 2,041. I keep track. We're going to have a big celebration of 1,000. We keep patient's name, date of birth, all the medical information, plus what time we start, what time we made a decision, what time we dock the robot, what time we undock the robot, what time we put the dressing on, and that way we can keep track so the surgeon knows, okay, when I do a prostate, it takes me 3 hours. Well, 3 years from now, it takes me 2 hours and 50 minutes, so I'm getting better. I'm getting faster. This is good. And if you look at the time from the time the patient gets into the room to the time we start, that shows you how efficient we are as a team on getting the patient to the bed, asleep, prepped, ready to go, and all that. So we're able to quality control every step of the way from the time the patient gets into the room to the time the patient leaves. And so that's what we do.
It's not like an Android is doing the surgery.
That's correct.
This is doctor-enhanced robot.
That's exactly right.
Makes what they're doing better or safer, or what would you say it does? Does it?
Well, okay. Number one, because of the magnification, it augments how well you can see, and it augments how fine you can move your hands, number one. Number two, it's infinitely safer because you're only working through these tiny little things. You don't have a giant incision. So infection rates are way lower than open procedures. Number three, it accounts for the jitter that we talked about. Number four, it has all the safety features about memory. When you do a traditional laparoscopic, you rely on the surgeon to put that instrument in every time and hopefully know exactly where they're supposed to go. And there is human error. It is what it is. But the robot doesn't have human error. You take the instrument out, you put it back in, knows exactly where it was, where it's going to go. Number three, everything that the robot does is controlled from the surgeon. Everything. There's no unexpected movements. In fact, if there is an unexpected movement, I can go over there right now and bump the robot, and all these alarms will sound, saying unexpected movement, check it out. All right? And one thing I haven't talked about is, in the event of a power failure, what happens when the power goes out in the hospital? There's a battery backup on the robot. There's a battery backup on the surgeon's console. We can work for about an hour on battery power alone. There's a whole process to go through when you start this thing up. It has to go through a bunch of self-checks like a computer does. It goes through instruments, all the cables, make sure the tensions are correct and all that stuff. And then when it's good to go, then it'll do what's called homing, and the arms will move to verify that it has range of motion. And then you're good to go. Well, what happens when you're docked and then there's a power outage? The battery backup takes over maybe about a second or two after, so it has to reboot. Well, okay, now what? Well, the robot knows, because there's connected to trocars, it knows that we're connected to a patient. And it knows that it can't go through its motions because you could damage the patient. So it bypasses all of the self-checks, it bypasses all of those things, and says, okay, we're still connected to a patient, we're running on battery power, we're in an emergency situation, we're just going to continue on. And then the generators, hopefully in the hospital, will kick on, and then we can run on generator power. All right, and then we've never had to do this, knock on wood, but every year, a couple times a year, we'll go through what's called an emergency undock procedure. That's if in the event of a catastrophic event, something happens that's unexpected, some Grey's Anatomy stuff, it's absolutely crazy, and all the alarms go off, beep, 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 which is completely fake, by the way. And we have to undock the robot and then come in and open the patient emergently. How fast can we do that? How fast does it take the surgeon to get out of there and get in? You know, and we're able to do it in about 8 seconds. So, and I've been trained to do as much as I can to give the surgeon 8 seconds to get in. So we go through all of that, but we've never had to undock. I've never seen a hospital have to undock, so we do pretty well. So any other questions? I mean, this was developed in 1985, a little history. Department of Defense came up with it, DARPA. They wanted to do battlefield surgery. They want to put this on the back of a Jeep and do battlefield surgery from long distance surgeons. They found out it's real fragile, so you can't be going over, you know, moguls and your things, so it wasn't practical. So they abandoned the project, and then Intuitive bought the rights, and they said, hey, we can use it. Let's do it for surgery in the hospital. And so after that, then the whole FDA patents and all that stuff had to be approved, and then so finally it came in.
My name is Taylor Barno, and something that I found interesting was the robot, Da Vinci, and how you can see what it's doing and you can see the smaller stuff.
My name is Vivi Avey, and one thing that I found interesting was the Da Vinci robot that could operate like instead of doing hands-on surgery.
My name is Peyton Bowers, and my favorite thing that we've done today is operating the Da Vinci operating robot used for surgeries, and I just really enjoyed it because I love VR and video games and stuff like that, and it seemed to really connect to that.